Understanding fetal heartbeat development and miscarriage.
Hello and welcome to this video, where we'll discuss an important topic related to early pregnancy, the development of the fetal heartbeat and its implications in case it's not detected when expected. This can be a sensitive topic as it often brings up questions about the possibility of miscarriage.
When does the fetal heartbeat develop?
The development of the fetal heartbeat is a significant milestone in pregnancy. Typically, the fetal heartbeat begins to develop around the 5th or 6th week of pregnancy. However, this can vary slightly, and it may not be detectable until about the 7th or 8th week of pregnancy, especially via ultrasound. So, there may be some variation, and it's important to not worry if the heartbeat isn't detected at exactly the 5th or 6th week.
What if the fetal heartbeat is not detected?
If a fetal heartbeat is not detected during an early pregnancy ultrasound, it may cause a lot of worry, but it doesn't necessarily indicate a miscarriage. As mentioned earlier, the heartbeat may not be detectable until a bit later. This could be due to a number of factors, such as a miscalculation of the pregnancy's timing or the quality of the imaging equipment.
When is it a sign of miscarriage?
However, if the fetus measures large enough, typically around 7 to 8 weeks or more, and still there's no detectable heartbeat, then it may be a sign of a miscarriage, or what's known as a missed or silent miscarriage. If this happens, further tests will be needed to confirm, such as a follow-up ultrasound or checking the HCG levels in the mother's blood. The lack of a heartbeat, in this case, is often due to chromosomal abnormalities in the fetus that make survival beyond the early stages of pregnancy impossible. It's important to understand that miscarriage is fairly common and most often is not due to anything the mother did or did not do. In conclusion, while the absence of a detectable fetal heartbeat can be a sign of miscarriage, it isn't always so. It's crucial to have open communication with your healthcare provider, and remember that each pregnancy is unique. If you're in this situation, try to stay positive and patient until you have a definitive diagnosis. Always remember that you're not alone and there are resources available to support you through any challenges that may arise during your pregnancy journey. We hope this video has provided some clarity on this important topic.